Do people experiencing homelessness have equitable access to primary health care?
Um, can I say something before I answer that
Yeah.
question? Because I missed it on the previous one and it just struck me. Um, the other thing, if we want to build better responses to homelessness, is we need to make a system in general that's accessible, where people aren't having to go to multiple places, fill out multiple applications, tell their story multiple times, and then wait.
Mhm.
That's not a seamless, integrated um, system of care. And so, and that brings me really to the primary care question. So, the equitable access to primary care, many people do not have a physician per se. I think one of the things in Canada that has been helpful is the development of community health centers, some of whom specialize in inner city health. But they're often, and I think, you know, they particularly focus on providing access to people that are homeless, but that doesn't mean they're integrated with the rest of the system, you know, with,
Mhm.
you know, so someone, um, you know, may face barriers because they don't have access to primary care. Um, or they may face barriers because, you know, I'm just trying to think because there's so much literature on access to primary care for people that are homeless. So I'm just trying to pull out some of the examples from there. But, you know, people may not have transportation to get there.
Mhm.
Um, they may not be able to access at the hours that it's available or make appointments, depending whether they have a phone or not. If they're, you know, responsible for caring for others, whether that's children or other family members, it can be difficult to prioritize primary care. And, you know, when they're trying to access primary care in the broader system, they may often face stigma as well and may not often feel safe to share what's going on, particularly if there are others involved, like children, for example,
Mhm.
to share that they're homeless even.
Mhm.
And so, James, I'm really answering it by saying there's kind of multiple inequities. There's inequities in getting primary care, and then there's inequities in trying to actually navigate primary care
Right.
as well. And I think inner city centers that specialize in providing primary care for homeless populations do definitely address the equity issue in that location. But that, as you know, isn't available in every community.
And when you get into rural health, um, all of these things are bigger,
Yeah.
bigger barriers to get, you know, transportation and number of primary care physicians or nurse
Mm-hmm.
practitioners or what have you.
Yeah.
It gets even
And
broader.
it's not always adequate. Like we do have uh, a a healthcare system that will um, that specifically deals with the homeless, but they're not accepting any new referrals until next spring, just because they're so backlogged. Like it's just
Mm-hmm.
not adequate enough to meet the needs that are out there.
Mhm.
Yeah.
So
Yeah. And then, James, I think that's a really important point is it's not adequate. Like people can't even get into it sometimes.
they can't right now
And they can't
at
right
all.
now.
Yeah.
But what I also think is that healthcare providers aren't really equipped to deal with the social determinants of health.
Mm.
And so you see someone who if and when you do get in and you do have access, and even if you have the bestest, nicest provider in the world, they're not going to be able to fix in some ways what the root issue is of your poor physical and mental health, which is your lack of housing, food, and
Yep.
income.
Mhm.
Um, and you know, I see that repeatedly. That's I mean, that's very distressing for many healthcare providers. And it's why I think, they immediately recognize the importance of advocating for housing and adequate income, because um, that is what, that's the foundation what people need. And, there was a little movement for a while. I haven't heard much about it lately, about physicians writing a prescription for housing, and I thought that was the kind of example of a healthcare provider saying, you know, I can't, I can't write a medical prescription for what they really need. What they really need is housing.
Hmm.
Yeah.
Absolutely. Absolutely.